This is your Houston chiropractor, Dr. Gregory Johnson, and today we have Tristan with us, who was involved in an automobile accident. What date?
June 9th.
June 9th, which is not even a month ago, right?
Yes, sir.
And this is your fourth treatment in here, right?
Yes, sir.
And how have you done so far since your auto accident, from the beginning to right now?
Pretty good.
Yeah?
Yes, sir.
Pretty good. Back to about where you were before the accident?
Yes, sir.
Great. And that's 4 visits. What would you tell our YouTube viewers about your experience here?
Wonderful experience. That's where I started off at. So it's been excellent.
Before the accident?
Yes, sir.
Yeah, that's good. Great. So we're going to show you how we did that. Let's go ahead and take a look in the mirror here. And let's check your posture then, Christian. I'm going to have you flex your head forward and then backwards, please. And then back to neutral. Yep. Now, Christian has been a pure delight to work with, by the way, because he has done all the things that we talked about doing beyond just getting the adjustments in here and the therapy and rehab that we do. He's going home and watching his posture, watching how he's sleeping, how he's sitting, how he's standing. So when the patients do the things that we talk about in here at home, they're the ones that get well the quickest and stay that way. And you've been very participatory, haven't you, Christian? Good man. Okay, so let's lay you on your back here. I still am going to decompress you. Got some new big fat pins for our decompression table today. It makes it much easier on the patient's iliac crest, which is the top of their pelvic bones. It's a lot softer. Let's scoot you down just a tad. There you go. And a little bit more on this side. There you go. Good. There we go. So we're still going to decompress him today, even though he's feeling great. He had no pain levels today at all, which puts him at a pre-injury status, which means how you were feeling prior to the accident. And at that point, we can feel good about releasing the patient from care. Take a deep breath in, let it all the way out, and just relax. There we go. Boy, did you feel that all the way through?
Yes, sir.
All right. So we got movement all the way from his skull down to his pelvis on that. Excellent. And he's still kicking. All right. Perfect. Now see, he relaxes really well too. So it doesn't tighten up and it doesn't hurt when it didn't tighten up, does it, Christian? Christian's like the model patient. So all you out there that have been involved in car accidents, pay attention. Let's come over here on your tummy. And face right down there. I'm going to put your head down just a little bit. Check his leg length. And it's exactly even where it's supposed to be. It stays even. And doesn't tighten up too much. Just a little bit right there, huh? So we're going to adjust his SI joint on the left first. And then the right one. And then the sacrum. Straight superior to inferior on the y-axis, and then L5, straight P to A, and the z-axis. There's L4, L3, L2, L1, and then I'm going to start down here, lower thoracic. Perfect. Now I'm going to put his head down a little bit to open these joints up. Mid-thoracics. Yep. Perfect. Good job. Now we got one more right here. That's it. There we go. Got them all. Now, does this feel any easier coming up to you this time, Christian?
Yes, sir.
All right, good. If you don't have any leg length deficiency on that or a positive Deerfield test, then you want to just check if the patient has any tightness on that when you bring the legs up. That's called a knockless test. That's also an orthopedic test. So we're still going to improve the circulation in his paraspinal tissues bilaterally, as well as his shoulders and pelvis. And we do the tensor fascia lata on the side. A lot of people call this their IT band. Hamstring bilaterally. TFL on the right side now, and up into his gluteus medius maximus and piriformis muscles, and all the way down into his calf muscles. Excellent. Tell me if there's any tightness or pain at all anywhere.
No.
Great. Okay, let's sit you up and face towards your knee for a sec. That way. There we go. Good man. There we go. Good. Okay. And on this one. And who referred you into us? Who? Oh, sorry, another patient of ours, right?
Yes, sir.
That's where most of our patients come from, referrals. And would you be happy referring somebody else in here?
Yes, sir.
Great. Okay, let this one go. There we go. Okay. There we go. I'm getting movement all the way through the pathway of the nerve so that we get excellent release in his nervous system. Okay, let's come over here in front of the mirror and we'll shoot you. Get hemmed up, lined up, ready to go back on the road again. As Willie says here in Texas. Okay, let's flex your head forward and then backwards again, Christian. So he's got great full range of motion with no interruptions whatsoever. He's lined up right down the middle, so we're just going to have to pull his shoulders up and back. Clear these hands, palms forward. And then we're just going to bring his head straight back and look straight up at the ceiling. And adjust his atlas on the x-axis with this instrument. This will send a barrage of neurological information into his cerebellum. You can relax. Everything. There you go. And just flex your head forward and backwards again. Perfect. Neutral. Excellent. Did that hurt at all?
No, sir.
Excellent. Very good. And this is your Houston chiropractor, and this is how you get well from being injured in an automobile accident. You were rear-ended or side impact? Rear-ended. So he had a whiplash injury to start off with, and we got him back to a pre-injury status in 4 visits. So this is your Houston chiropractor again. We'll see you next time.